Community, we are seeing a rise in strokes from young people. There's a few common types of strokes, but we are seeing more of one fairly common in younger people. So joining us right now is stroke specialist Dr. Cynthia Dickerson with HCA HealthONE Swedish. Thank you so much for joining us. We appreciate that.
Absolutely.
Yeah. Can you explain the stroke you are seeing more often and how does it occur, and what age are we seeing this now too?
Absolutely. Well, there's a rise in strokes in the young for a lot of different reasons. So there's a lot of contribution. A lot of this is undetected chronic illnesses such as high blood pressure, diabetes, even heart disease that's kind of going undetected, and young people aren't going to their doctors and getting detection of these. Even things like drug use, tobacco use are also contributing. But there's one reason that young individuals without any of these medical conditions are having stroke, and that's actually due to a hole in the heart that everyone is born with, but sometimes goes undetected until someone comes in with stroke-like symptoms.
Okay, so when a young person has an unexplained stroke, what steps do doctors take to check for a PFO? Is that the hole in the heart that you were just referencing? Okay.
So there's a few different tests. One is an ultrasound of the chest, looking at the heart itself, and we inject some bubbles through the IV to see if they pass through that hole. There's also a down-the-throat camera test, but interestingly, and I see this not infrequently in my role, this finding is missed on those tests, and that's for a variety of reasons. The camera test is actually, the patient isn't able to fully participate in the testing. So there's an additional test called a transcranial Doppler. It's that same echocardiogram of the brain, or an ultrasound of the brain, looking for that passage of holes, and we can actually detect it up in the brain. And it's actually sometimes more sensitive than some of these other tests, and sometimes goes unmissed if it's not known about or sent.
Yeah, you already mentioned some of the things that could lead to stroke, like smoking, for example, or what have you, but what are some major preventable stroke risks?
That's great. So, yeah, smoking is one of them. Drug use is another one. And then, honestly, getting a lot of screenings. Some young individuals are not aware of genetic predispositions they may have when cardiac disease runs in the family. But other simple things like diet modification, regular exercise, these all do contribute to factors that put people at risk of stroke over time. And
what warning signs should people not ignore, even if they're considered healthy?
Absolutely. So we like to use the acronym BEFAST, B-E-F-A-S-T. B is for balance, the inability to walk straight or severe dizziness. E is vision loss, loss of vision in one eye or both eyes. A lot of times people go to their ophthalmologist and they miss that it's a stroke-like symptom.
Wow.
F is the classic facial droop, but also numbness on the face. And then numbness or weakness of the arms is the A. Also counts for leg, it just didn't fit in the acronym.
Yeah.
And then S is speech, not being able to get your words out or comprehend what other people are saying. T is time, do not wait. Even if you're young and think there's no way I'd be having a stroke, don't wait, go right to the hospital to get more information.
And that is the key right there. Doctor, thank you so much for joining us. We appreciate it. You can watch all of our interviews, by the way, on our website at cbscolorado.com. Michelle?
All right, Brian, thank you.